Yes, shall we start, guys? Good evening again. How are you all? I hope you are doing good, guys. Shall we start? Okay. Am I audible, guys?
Yes, sir, you're audible.
Great. Thank you. Thank you very much. Thank you, everyone. So let me share my screen and let's start. Let's not delay. Wait. RFS. That's a rapid response, guys. Lot of people are communicating with me. Thank you so much for a rapid response. Thank you so much. I think someone is watching TV, guys. You watch the TV later, okay? Okay, so let's start. Yeah. So, guys, where we were in the last class, we were, I believe, here, right? We were here, like how the system circulates in the circulation system in the body, right? So, from SA node to AV node, right? Covering both the atriums, and then from AV node to, left and right branches of one, this bundles, right? Which are subendocardial bundles. We call them, if it is going to right side, it is called as RBBB, right? Bundle branch, right? And the disease which is associated is block, right? So usually when the patient comes, and you must find easily that the patient has come with RBBB or LBBB, right? So if we talk just RBB, that is right bundle branch, LBB, that is left bundle branch. But if there are any problems in the circulation system, sorry, not circulation system, that is conduction system, right? So if there is any problem in the conduction system, that is called block, because usually when a wire gets fused or gets broken somewhere, there is always a block in the flow of electricity, right? In the houses, right? In your houses, suppose one wire is going to, some room, and it gets fused, or it gets broken from somewhere, then it is definitely a block of electricity. So electricity cannot pass through the wire, and it cannot go to the other room. Like circulatory system, see, circulatory system is like when the veins and arteries work. So through the veins and arteries, like if there is block also, if until it is not 100% block, some of the blood is flowing, right? Some of the blood is flowing. But usually if the if there is a fault in the wire, if that is broken or something, there is nothing which will be crossing, okay, which will be crossing. So here that is the system what usually works. What usually works, there are in the other zones, there are some difficult criteria also that we'll tell later, right? In the when we are talking about the arrhythmias, right? But this was usually the normal circulation system of normal conduction system of the heart, right? Normal conduction system of the heart. So let's go further and let's understand, right? So can you please tell me how many of you understand this diagram here, ventricular action potential? Do you guys know this ventricular action potential? How many of you understand this action potential curve, ventricular action potential curve? So till now, in just last past 1 hour, like in the last class, we understood the anatomy of the conduction system of the heart. Today we'll be understanding the physiology and some of the ECG, because our major part is ECG. But before getting into the ECG, we must understand like what is the anatomy and physiology of the heart, right? How the ECG works in the heart. So anyone of you understand this ventricular action potential before that has seen? Do you know what is this? How it works? Guys? Okay, so I'll keep you all on mute, guys, okay? You all will be on mute. You cannot speak until my class is over, right? Now you can only chat if you wish to. Yes, so tell me, guys, if anyone can answer this to me, right, guys? If someone can answer this, no one knows about this. Okay, let me tell you. Let me tell you how it works. See, so when we go to this space, right? This conduction system and the cardiac cycle, there are four steps usually that we have discussed already in the last class also. So first step is the pacemaker impulse the generation. Pacemaker means your SA node, sinoatrial node. Then it goes to AV node, impulse conduction, right? The impulses are, impulses are flowing, right? Impulses are passing on through the AV node, and that goes to the bundles, and through the bundles that goes to the Purkinje's fibers, and there they generate the conduction, right? There they generate the impulses in the cardiac walls or different side of the heart, right? Left side or right side. So that causes the contraction, that causes the contraction or relaxation of the heart, that causes the contraction or relaxation of the heart, right? And that can be definitely, heart rate, as you see, or the conduction system can be affected by various factors like the exercises or the temperature or the your hormones, right? These things can easily uh, change, or these things can easily influence your cardiac conduction system. Okay, now let's go to next slide and understand what is the physiology. So here that is called ventricular action potential, or we can say that how the myocardial action potential curve works, right? So you will see that uh, definitely when it is heart, then definitely all the four chambers will be involved in this. Either those are atrium or those are ventricles, right? So the entire process happens through the atrial or ventricular myocytes. Myocytes means atrial or ventricular myocytes means the cells, right? The cells or the muscular cells of the heart wall or the septums, right? When we are talking about myocytes, myocytes means the cardiac cells, right? Or the muscles inside the heart wall, or the septums between ventricles, or septums between the atriums, or septums between atrium and atrium and ventricles, both the side, right? So all the conduction system also goes like that, right? It is simple, very simple. I always give the example of the home, right? In your house, in your home, you must have seen that usually in the well constructed home, because our heart and body is well constructed, right? I always consider heart is the most complicated and well constructed well constructed anything like creature, or well constructed body, if I say. So that is well constructed part, right? So similarly, in a well constructed house, how the wires goes, wires did not just go fly in the air, right? Wires goes through the wall, right? Wires are fit in the wall or in the roof, or in the septums. If you look into the heart, that is called septums. The walls in between are septums. Walls upper and down are the wall of the house, right? The major walls of the house, or the partitions, right? So septums are the partitions, right? Septums are the partitions, suppose, in the house, right? And similarly, the roofs and the other things are the wall in the heart, right? Wall in the heart. So similarly, how in the house the electricity goes in the walls, similarly in the in the heart, the electricity means the conduction system, or the impulses, impulses flow through the cardiac walls or myocytes, right? So how it actually starts. So first thing is, when it is in the myocytes, when the impulse generated from SA node goes to the AV node, Purkinje's fibers, and right bundle, left bundle. I mean, when it goes to the end, in every cell of the heart, every cell of the heart, so there are five phases, entirely five phases. So phase zero is rapid depolarization. Okay, if you look at this stage zero is a very, very quick, very fast stage, rapid. We call it rapid depolarization, where sodium enters into the cardiac cells from the outer layer. Sodium enters to the cardiac cell, right? So when the sodium goes inside the muscles or the cells, they gets positive, insanely positive immediately, because it doesn't take even fraction of second. Try to understand, this is very simple. You don't have to put your brain much here. So it just takes fraction of second. The first phase is rapid depolarization. Depolarization means cells are getting positive. Then how they will get the positive? The entire sodium goes inside the cell. Sodium enters to the cell rapidly, very rapidly actually. And when the sodium is in the cell gets positive, right? Cell gets positive and it starts contracting. Okay, cell starts contracting means your heart wall gets contracted. Okay, when the heart is contracted means the blood is going out. Either it is right ventricle or left ventricle. So when the right ventricle is contracted, your blood will go to the lungs. So that is the mechanism. And at the same time, your left ventricle is also squeezed or contracted, and that time the blood from the left ventricle will go to the body, right? To the body parts, different body parts. So here that is like the output, right? Here it is the blood output. So blood is going out of the heart, either from the right ventricle it is going to the lungs, or from the left ventricle it is going to the body, right? So rapid depolarization happens because they need positivity. The cells need very much positive ions, very high level of positive ions. So suddenly the rapid bumper entry of sodium goes to the cell, and the cell gets positive and heart contracted, right? So then the immediately next phase comes into, because so the cell should not get damaged, or cell should not get positive or stressed for the longer time. Immediately the phase 1 starts. The phase 1 is early rapid repolarization. First was zero was depolarization. Now it is repolarization. So to maintain the positive and negativity, like, so this is now very high positivity inside the cell, very high positive, high number of positive ions, high level of positive ions inside the cell. So what happens now is, now to maintain, sodium is inside, so potassium starts leaving the cell. You understand? Potassium start leaving the cell at 1. Here, if you look at the curve, at the phase 1, potassium starts leaving the cell. Okay, potassium starts leaving the cell. And what happens at that point of time? When the potassium starts leaving the cell, contraction, start converting to relaxation, right? It starts the relaxation here. Very minor relaxation, not completely contracted, but it is there. The contraction is there, but it starts to relax now. The heart wall starts to relax now. And when it starts to relax, suddenly, so it can be rapid, because as rapid as sodium went inside, potassium can come out. But to maintain that, again, to maintain that positivity inside, suddenly when the potassium coming out rapidly, potassium when the potassium coming out rapidly, calcium starts going in. Calcium is like two ions, two positive ions. Sodium is one positive ion, and potassium is one positive ion. So when the sodium was inside completely, potassium started coming out. So it can, there is a chance of getting very immediate repolarization, immediate, like, contraction, then relaxation, contraction, then relaxation. It will be very fast. So we need something to like maintain it for some seconds, right? To maintain it for some seconds. So immediately, to maintain that, potassium enters the cell, sorry, calcium enters the cell. Calcium has two positive ions. So even the less amount of calcium makes that plateau means makes that make the cells stable in the contraction phase for some time, like kind of 1 second, like half of the second, actually half of the second to point 8, point 9 sometimes. So like, suppose 1 second, like kind of 1 second, it keeps it keeps your heart in the plateau stage, where the heart is completely empty, right? So in that contraction phase, why we need the plateau, or why we need the stable phase? Because of the calcium inside, we need that stable contraction phase, because the heart needs to pump out the entire blood, or maximum blood. Entire blood means maximum blood out of it, right? Out of the ventricles, either to the lungs or to the body, right? So that phase is called plateau phase, where heart is stabilized with the contraction and blood is going out completely. Okay, then the third phase is final rapid repolarization. Suddenly all the potassium comes out, all the potassium comes out, and the heart wall gets relaxed. Heart walls get relaxed, and because of that the blood comes to the heart, or blood starts coming to the heart again to fill all the chambers, right? To right ventricle, left ventricle. So it gets filled again, right? It gets filled again in the phase 3. And phase 4 is again slow depolarization. So again it's again it is making the base for the next beat. So this entire phase is a beat. In the ECG, this entire phase is a beat, right? So this is called one beat, right? So for the one beat or one rhythm, right? This is called one beat or one rhythm. So for one rhythm, it needs the whole process, right? So now at the phase 4, after the 4 phases, phase 0, phase 1, phase 2, phase 3, where suddenly now in the phase 3 final rapid repolarization. So now entirely heart is relaxed now and potassium is completely coming out. Now immediately after that, what happens is the cell starts preparing for the next cycle of rhythm, or the next rhythm. So for that, what happens is slow depolarization. Slow depolarization means potassium is out, and even sodium and calcium comes out of the cell. So cell is completely negative, and then suddenly again suddenly it will happen the rapid depolarization, where all the potassium sorry, all the sodium will go in and make the heart contract. Understand? So is it clear, or having any doubt here, guys? Please confirm. Any doubt here, or you understood, or you want to understand it again? Did you get it? Clear for all? Is it clear for all? Okay, great. Okay, so I hope it is clear. I hope the physiology of the rhythm is clear, and rhythm is the beat in the ECG, right? Rhythm is what we are talking about, ECG, right? Rhythm means the conduction system, entire conduction system. This is the conduction system. Action potential means this is the conduction system, and this all happens in the very shorter time, less than a second, right? Less than a second, it all happens in the less than a second. See, if you look at here, 100 millisecond. 100 millisecond means like a very less number. This stage 4 is very less, so the entire part is also very shorter. It happens within a kind of within a second. This entire thing happens within a second, right? And this is called the rhythm cycle or ventricular action potential. Okay, so here you can understand it easily. Depolarization means a sudden electric sparks start where sodium rushes into the cell, and the cell, and the cell becomes positive inside, the muscle contracts. Early repolarization, which was phase 1, the cell begins to recover slightly, like potassium start to leave, the voltage drops a little bit. The voltage, it is talking about ECG, the voltage, reversing to reversing a little. Then plateau means the electrical charge stay steady for a while. Flat phase, because that calcium goes inside slowly while potassium leaves. So this keeps a plateau, or this keeps the cell stable. So what does it mean? That result is the balance keeps the cell depolarized. This allows the heart muscles to stay contracted long enough to pump the blood effectively. So all the blood is coming out of the ventricles, right? And then repolarization phase 3, that is early repolarization. I mean, sorry, that is repolarization. The final repolarization, early repolarization is phase 1. Final repolarization, the cell resets to prepare for the next beat. Potassium leaves, and the calcium channels are closed, so calcium cannot go in more, right? And results into inside becomes negative again. The muscles are relaxed. Then resting phase means cell is resting and ready for the next signal, right? Ready for the next signal means here sodium and potassium ions are completely balanced. All the sodium and potassium ion which are extra are coming out, right? They are out, and here sodium potassium is completely in the balance, right? So that means the heart is ready for the next beat. It is very simple phenomena. It is very simple phenomena, very simple physiology of the heart. So all is about what you have to understand. It's all about sodium, potassium, and calcium. How the sodium enters, how the potassium comes out, or potassium enters, calcium goes in, potassium comes out, and that it balances, right? So there are 5 phases. Remember that. One is zero depolarization, and then next phase, phase number 2, but phase 1, right? Phase number one, when I'm talking about number 1, 1 second, guys, I'm getting a call from I'm sorry, guys. My mom called actually in between. Okay. So, yeah, this is the entire physiology. Now, can you, sir, can you just answer some calls? Okay. So this is how like it looks like, electrocardiogram. So, P wave, then PR segment, then, ST segment, then, T wave. So it is all how it starts. It is all how it starts. So can someone explain, looking at this, like what is repolarization, where is depolarization, guys? Can someone tell me? Yes. Can someone explain in the chat box? You are not allowed to talk because people were disturbing us. Yes. Can someone tell me what is that? Okay, so look, it is very simple. Okay, it is very simple. When you look at P wave, P is the atrial depolarization. Atrial depolarization. P wave is depolarization. Okay, depolarization. Depolarization. Array. Where are you reading? Okay, that is depolarization. But which phase? Which phase is this? P is which phase? Tell me, P is which phase? Zero. Okay. No. Look at ECG. You'll understand. Okay, so see, where it is highly positive, this QRS complex is a rapid depolarization. It is rapid depolarization. This is rapid depolarization, right? This is rapid depolarization. See, if you look at this, this is rapid depolarization, right? Rapid depolarization. So always look at this, look at the stage, right? So this is very much positive charges. Okay, here this is very much positive charges. And then it goes for it goes for plateau. Okay, this is where it comes down a slightly, slightly it comes down, and this is plateau, not this. This is the gap between two beats. This is the gap between two beats where it starts, right? So P is what? P is not what you are thinking. P is phase 4. P is the last phase. Okay, P is the last phase. Okay, P is the sorry, yeah, P is the last phase, and this is, this is plateau. Okay, P is the last phase, this is plateau, right? This is rapid depolarization. Then again, repolarization means when, the potassium comes. This is, see, look at this now. I'll tell you, I'll explain you. See, suppose it starts from here, not from here. Look at this. Let's just keep the P wave out. You will understand it easily. Let's just keep the P wave out. Okay, keep the P wave out. And when it goes to the, PR segment, that is the gap. Okay, and then here, like, it is a sudden depolarization, like rapid depolarization, phase 0. And then phase, 1 is this is phase 1, where, this is phase 1, right? This is phase 1, where the calcium goes in, like, to make the balance, but then suddenly, to keep it stable, calcium goes in. ST segment is showing the calcium goes in. This is the plateau. Okay, this is the plateau, and then repolarization starts. Repolarization, T wave shows the repolarization here. Okay, I'll show you this also. Repolarization, here it shows the repolarization. So here it is balanced. Okay, it is balanced thing. This is plateau, but this is balanced thing. T wave is normal balance, where there are some negative charges and some of the positive charges. Some positive charges are also there, but not completely negative. Okay, this is plateau. In ECG, this is plateau. Okay, so don't think that positive charges will show high, negative charges will show down. No, no, no. It is just showing the balance here. In ECG, it shows the balance. Okay, and then this is the phase where things goes fine. Again, it is preparing. So from here to P wave, this is preparing phase. Okay, from TP segment and P wave, this is the preparation phase. Okay, this is the preparation phase for the next beat. Okay, this is the preparation for next beat. Next beat. So this is usually phase 0. This is phase 1, phase 2, and phase 3, phase 4. Okay, phase 4 is like, again, little balance, right? Little balance. It is here, it is preparing for the next beat. It is preparing for the next beat. So QRS is rapid depolarization. After rapid depolarization, a little repolarization and plateau, and then it is preparing for the next phase where calcium and all comes down, and here it gets relaxed completely. Here it gets relaxed. So ST segment is plateau. Okay, QRS complex is rapid depolarization. ST, this depression, like S depression, ST depression, this is about when the potassium goes in and it tries to balance, right? When it tries to balance, and then the ST segment is plateau. Okay, plateau, and then it suddenly, what happens is, then suddenly calcium also comes out and it tries to become negative, and here this is preparing for the next beat. It is preparing for the next beat, right? So P is not starting, P is ending of the phase. P is ending of the phase 4. This is phase 4. From here to here, it is phase 4. Okay, okay, this is phase 4, not phase 1, right? This is phase 4. Usually this is phase 4, right? But you don't have to connect like this. You don't have to connect the ECG with the phases. You have to connect the physiology of the heart with the action potential curve, right? Action potential curve, because here it won't say the potassium less or something. It will show the hypokalemia. It will definitely show the hypokalemia, this natremia, hyponatremia, and hypokalemia. It will show, ECG shows the hypokalemia and hyponatremia. That I'll show in the cases, when I'm showing you the cases, when I'm explaining the cases where it is showing the potassium depletion, sodium depletion in the ECGs, you will come to know, right? But right now, don't try to correlate, don't try to make it complex. I'll explain everything in the upcoming classes. Okay, I will explain in the upcoming classes, so you don't have to worry about, right? Don't explain or don't correlate this ECG right now for you. I've explained though, but don't correlate this with that typical action potential curve. Okay, action potential curve is the phases. Just try to understand how it works, how the relaxation and contraction works, how the ions work in the heart, right? That's all. So here are some conditions, where the electrical activity of, occurred during the depolarization and repolarization. So usually we get, these all the waves or all the impulses. So when we connect the ECG to the heart, we collect the impulses, right? We collect the voltage, electricity. We collect the actual electricity, the low intensity electricity through the what? Through the when we attach our electrodes, when we attach the ECG to the body, there are some metal bases, and those metal bases are electrodes. Okay, those metal bases are electron, not exactly metals, but those are electrodes, and those collect the impulses from that zone, right? Impulses means the voltage, right? Voltage of the electricity, and that voltage variation is seen in the ECG, right? So P wave indicates atrial depolarization, right? That is last phase, not the first phase, right? P wave indicates atrial depolarization. PR interval indices the spread of impulses. So it, like, spread of the impulses means it is in the completely preparing for the next phase. Then QRS complex indices, indicates QRS complex indicates ventricular depolarization. Ventricular depolarization is phase 0, right? ST segment indicates phase 2, right? ST segment indicates phase 2. ST segment means that was plateau, right? ST segment was plateau. See, look at this. Yeah, if you look at this, ST segment is plateau, right? This is plateau. This is, sorry, this is plateau, right? This is ST segment, right? And this is the rapid depolarization. This is phase 0. This is phase 1, this is phase 2, this is phase 3, and this entirely is phase 4. Understand? This is very simple, right? So QR prolongation is measure of delayed ventricular repolarization. QT prolongation, Q to T prolongation, the prolongation of the Q to T shows that there is a delay in ventricular repolarization, and it is polymorphic ventricular tachycardia. So these are the tachycardias wherever. So that we will discuss in the later part. Let's not get into, right? So there are some medications which can cause, QT prolongation or some tachycardias like macrolides, like antibiotics like clarithromycin or erythromycin, or maybe fluoroquinolones like gatifloxacin is known for QT prolongation. Okay, and methadone is known for QT prolongation. Then, ondansetron, domperidone is also known for QT prolongation. Okay, and then the another thing what we understand here is the ejection fraction. So the ejection fraction of end diastolic volume ejected in each stroke volume. Ejection fraction is, like someone was asking that day, what is what is cardiac output, right? What is cardiac output, right? So it is like diastolic, and diastolic volume means when your heart is depolarized, or in the simple language, in the layman language, when your heart is contracted. So both the ventricles throw some blood out to the lungs and to the body, right? So ejection fraction is the percentage or the pumping capacity of the heart, that is like percentage of the blood goes out, right? Percentage of the blood goes out with each stroke, right? In one beat, how much blood is going out. So normal ejection fraction is 55 to 70%. Okay, so 55 to 70%. And if it goes less, or sometimes it is normal also, then it is called, I mean, these are the heart failure conditions where usually heart failure is classified based on the, ejection fraction. So if the ejection fraction is lower than, 50 actually, lower than 50, then it is called heart failure with reduced ejection fraction, right? Nowadays, why it is written 40 here is because nowadays heart failure is classified into three types. One is heart failure with preserved ejection fraction, where your ejection fraction is more than 50. It is completely normal. Okay, it is completely normal, right? Ejection fraction is completely normal, but there are functional abnormalities in the heart, right? And then 42, I mean, sorry, then 40 to 50, this area is called gray area. This range of ejection fraction is called gray area, because that happens usually because of the myocardial infarctions, arrhythmias, or something that is recoverable. That is in the recoverable stage that can be reversed easily. So that is called as heart failure with mid-range ejection fraction, and less than 40, it is called heart failure with reduced ejection fraction, where it is a real heart failure, where the actual pumping capacity is going down, right? In the heart failure with preserved ejection fraction, the pumping capacity remains normal. Okay, so with this, the first thing is, now we can go to the next class, okay, which is all about the ECGs. Let me share that. So did you understand till now, guys? If you understand, say yes just now. It's all clear? All clear till now, guys? I hope you understood the physiology now. Okay, great. Okay, so let's understand the ECG. So we will talk about ECG, waveforms, leads, placements, ECG and MI, right? So ECG is one of the most useful investigation in the medicine, because that, talks about all the cardiac related diseases, right? See, if this is house, right? There is one house, and in the house, if anything happens, sometimes electricity, see, some problem is in the wall, some problem is in the roof, or some problem is in the divisions, right? Dividers. So anywhere there is a problem, usually somehow the electricity gets affected. Somehow the electricity gets affected, and that can cause problem to the entire house also sometimes, right? So similarly in the heart, whenever there is a problem, heart is one of the most important organ of the body, right? Because if the heart goes defected, then your life is in the danger, right? Your life is in danger. So that's why heart is one of the very important vital organ of the body. And if there is some problem, we need to investigate it. We need to find out what is the problem. And ECG is one of the important tool to diagnose cardiac problems, right? Because it takes, it takes all the voltages from entire body. It compares the heart voltages from the different sides. Okay, it compares all the electricity, it compares all the voltages, it compares all the impulses, and tell us what are the problems, at which side of the heart the problem is actually happening, right? So to see that, we go for, go for ECG. So electrodes, ECG has the electrodes which are attached to the body, right? Which are attached to the body, and those electrodes catches or captures the impulses, or we call them the electrode, I mean the electricity impulses or the voltages. It captures the voltages and convert it into the waveforms, convert the voltages into the waveforms. However, voltage, in the fraction of second it catches or captures, it converts them into the waveforms, right? Then I think definitely this is just a definition. Electrocardiogram records the electric signals from the heart to check for different cardiac conditions. Electrodes are placed on the chest to record the heart's electrical signals, which causes heart to beat. Okay, and the signals are shown as waveform on the attached computer monitor or the printer, right? ECG, you must have seen, like the people who have not seen ECG. ECG is a small device, a small tool. Nowadays, there are pocket ECGs also available, right? So, or there are some big device like a laptop, a little thicker, right? And that has some connections that will be attached to the computer printer, or that will be attached. And then again, at the another side, it will be attached to the some wires which are coming to your which are coming with the electrodes and attaching to your body, right? So, and that's how it captures the electric captures the electricity or the impulses or the voltages from your body, from your heart, and it gets into the ECG machine and converts them into the waveform, and that waveform goes to the print, right? And that's how you look into it. So electrocardiogram is a painless, non-invasive way to help diagnose many common heart problems like heart attacks. It's very important, right? A healthcare provider might use an electrocardiogram to determine or detect, first of all, arrhythmias, all the irregular heart rhythms. Then most of the common drug-drug interactions leads to QT prolongation. Is it considered serious condition, or how we can manage the condition to overcome when both drugs are needed to the patients? We always check, Dr. Akila, definitely it's a wonderful question. So in that case, we go for the risk-benefit ratio, right? Usually we don't give even a single medicine if it is causing the if it is causing the QT prolongation, because that is arrhythmia, and that can be severe arrhythmia also, right? That can be severe arrhythmia, bradycardia, cardiac arrest. It can lead to cardiac arrest also. Okay, so we don't give such medications, or we give with the precautions, or we give under the observations when the patient is admitted. Okay, usually these fluoxetine and all, you must have seen, these are given IV or IV bolus, or in that formats, or the injections under the supervision in the hospitals, right? But if there are two such medications, we usually avoid completely, right? Because that could be a danger to the patient, that could be a very severe side effect or adverse event to the patient, right? In that case, we either keep the frequencies at different times, keep the doses less or frequency at the different times, or if it is completely necessary, then we go with the low dose and under the highly supervision, a restricted areas in such cases. And that is also after checking the benefit risk ratio. If the benefit is higher than the risk, then only we provide or prescribe such medicines. Otherwise we don't prescribe, right? Right. So irregular rhythms, and then if blocked or narrowed arteries like coronary artery disease, or if you had the previous heart attack also, it can detect or automatically, like someone has the heart attack 2 years back, 1 year back, automatically it can be detected in ECG, because the voltage must be changed, right? And how well certain heart disease treats, like the pacemaker and all, if they are working and all, if the pacemakers, ICDs, or other cardiac devices are working properly, we can check by ECG, right? So these are the common indications for the ECGs. Otherwise, other than that, there are a lot to check by ECG, like your hyponatremia, hypokalemia, other diseases, or other problems which can lead to the cardiac problems, right? In the cancers also, it helps in assessing the cardiac diseases, right? So this is the simple ECG that you have already seen. This is the simple ECG looks like. This is the normal ECG. This is the perfect ECG. So look at this. P wave looks like this, a little upward, little upward, then PR segment completely flat, then strict and very very high tall, very tall wave of QRS complex, right? So this is called QRS complex, very high wave, very tall wave, right? And then ST segment again again flat, and then the T wave looks little upward but not like the QRS complex. So this is the normal rhythm from here to here, right? This is the normal rhythm from here to here. You can see that, and this entirely is normal ECG. Okay, then you will see a lot of abnormal ECGs. So here you can see, right? Here you can see that we have described already. So this is atrial depolarization. P wave is atrial depolarization, which is contraction. Sorry, not here. It starts from here, and then QRS complex is ventricular depolarization, complete contraction. This is, relaxation begins, plateau, relaxation begins, and at T, the relaxation is happening, and then again preparing for the next phase, preparing for the next phase. Okay, preparing for the next phase. So this we have already discussed. Now, this we have discussed. Now tell me this. Okay. Now tell me, guys, I'm opening your mics also. This is a very interesting question to all of you. This is a very interesting question to all of you. Can you tell me what are the types of ECG, guys? Write or speak. What are the types of ECGs you have seen and where you have seen? You have to tell me. Yes, guys. What are the types of ECGs you have seen and where did you see those? Yes, please. Answer, guys. This is a very important ECG class, na? You have to talk. You have to tell me the ECG types. 5 ECG lead. 5 lead ECG. Not 5 ECG lead. 5 lead ECG. You must have seen. Based on the number of leads. Okay. How many types you have seen? You must have seen on the slide also, right? I accidentally opened that slide. Yes, tell me, guys. Tell me, tell me. Yes. What are the types of ECGs? Based on the number of leads, I know, but what are the types you know about the ECGs? How many types of ECGs do you know, guys? 12 lead ECG. Achha, tell me, where did you see ECG mostly? How many of you have seen ECG or happening ECG on someone? Or like, where did you see the ECG? How many types? Resting ECG? That's what I did not ask. I asked like based, okay, fine. A resting ECG, okay, when the person is resting. 12 lead ECG, anyone else? Especially in emergency room. What ECG did you see? 12 lead ECG? Okay. Ambulatory ECG. Okay, very interesting. Silpa has said here. Stress, not Silpa. Sahana has, very, nicely said ambulatory ECG. So now see, there are two types of ECG. We can see here. Preeti said ER, emergency rooms, and Sahana said ECG in the ambulation. I mean, the ambulances, right? So can someone tell me the difference between ambulatory and uh, in the emergency room ECGs? Means always measuring, always in the movement. Okay. Yes. Can someone tell me the types of ECG, please? In the hospital, you all are working in the hospital or interns or someone. Please tell me what are the types of ECG you've seen. Treadmill ECG. Oh God. Yes, treadmill ECG. Home monitoring. That's different. That is rhythm monitoring. Okay. Acha, based on the leads, tell me how many leads are there in the ECGs? What are the leads count in the ECGs?
Sir, are you talking about that TMT or halter monitoring? Such things?
Here people are talking about that treadmill, Holter, home monitoring, everything. Just tell me what are the types of ECGs? Okay, now based on the leads, suppose you are talking about 12 lead ECG. So what are the other ECGs types based on the leads? Just leads. Yes, guys. Okay, let me tell you. There are three types of ECGs based on the leads. One is 3 lead ECG, one is 5 lead ECG, one is 12 lead ECG. Can someone tell me what is the lead? Yes, guys. What is the lead? Loudly, I cannot hear. Whoever wants to speak. Yes. What is the lead? Yes, people. Wire attached to the patient. Fantastic rank. Anyone else? Anyone else? Electrodes. Leads are electrodes. Okay. Leads are electrodes. Okay. Which measures the electrical potential in the body or from the body, like the impulses, what I was talking about, or voltage or the potential. Yes. Okay. Measures electrical activity. Those are leads. Are you sure those are leads? Frankly, if you are telling those are leads, then I promise I have worked in cardiology for almost 6, 7 years. And still I'm working in the hospital where I see the cardiac patients every day. I promise I have never seen 12 leads. I can guarantee that I have never seen 12 leads. If you're telling that the leads which are attaching to the body are 12, I have never seen such. I have never seen a person attached with 12 leads. Never ever in my life. Yes, so how can you say that is 12 lead ECG? But yes, that is 12 lead ECG. 5 lead ECG, 3 lead ECG. Let me tell you. Let me tell you guys, don't be confused. Okay. So see, look at this. Look at this. 3 lead ECG, 5 lead ECG, and standard 12 lead ECG. Okay, so lead does not mean electrodes. First of all, differentiate. Okay, differentiate. There is a difference between lead and electrodes. Electrodes are the part of physical ECG which is attached to your body. Okay, physical attachment to the body from the ECG machine, that is called electrodes. So 3 electrodes, 5 electrodes, 10 electrodes, maximum 10 electrodes. Now if I'm telling electrodes, what is lead? Lead is what is generated in your printer, how your ECG machine is converting your impulses or voltage potential into the into the waveform. Okay, it is just for the view purpose, it is for the view purpose, it is for your visibility, how you can check. So there are 3 lead ECG, 5 lead ECG, and 12 lead ECG. So it shows 12 leads on the paper. Okay, but there are not 12 electrodes. Electrodes are just 10. Okay, so there are 3 lead, 5 lead, and standard 12 lead ECGs. But electrodes are different. In 3 lead, definitely there are 3 electrodes only. In 5 lead, there are 5 electrodes. But in 12 lead ECG, there are only 10 electrodes. Understand? Clear? It is very simple to understand, right? Now let's check one by one. So if you see here, this is a 12 lead ECG. Okay, 12 lead ECG means here you can see easily different 12 futuristic what we say them, features or different waves, right? So this is one first lead, this is 1, right? This is 2, this is wave 3, this is AVR, this is AVL, anterior. Okay, these are posterior, V1, V2, V3, V4, V5, V6. So there are 12 representing features. Okay, in this 12 representing features, that is called 12 lead. 1, 2, 3. So 1, 2, 3, AVR, AVL, AVF, right? AVR, AVL, AVF, and then V1 to V6. These are anteriors, these are posteriors of the heart usually. Okay, upper part of the heart, lower part of the heart. This is 12 lead ECG. So lead 1, lead 2, lead 3, lead AVL, I'm sorry, AVR, AVL, AVF, right? V1, V2, V3, V4, V5, V6, right? That's how the 12 lead ECG looks like. So let's understand the leads. Okay, so there are the placements, like placements of electrodes. Okay, electrodes, right? Electrodes. So when and how we put the electrodes and how these things come out. See, so if this is a 3 lead ECG, so if this is a 3 lead ECG, understand, if this is a 3 lead ECG, then The first electrode will be at right arm, second electrode will be at left arm, and then this is the third electrode. Okay, third electrode will be at your left leg. Left leg, because there will be more prominent potential than the right leg, because heart is in the left side, so it captures most of the impulses in the left side. So in the 3 lead ECG, only right arm, left arm, and left leg. Okay, in 5 lead ECG, right arm, left leg, right leg, and one brown color lead or brown color electrode at the center of the chest. Okay, central chest, or we call it sternum, over the sternum. It is placed over the sternum, right? 5 leads, right? If it is the 10 leads, how it works? In the 10 lead, I mean, sorry, in the 10 leads, 10 electrodes or 12 electrodes, there is nothing on sternum. Okay, there is nothing on sternum, but one on the right arm, one on the left arm, one on the left leg, one of the right leg. Okay, so usually these are the color codes for the ECGs. Like right arm is white, left arm is black, left leg is red fire, and right leg is green grass. Okay, and then there are, other six. So other six are placed on your chest. So the V1 is at the sternum edge. Okay, right fourth intercostal region, ICS, intercostal region, right? And V2 is sternal as left fourth ICS. V3 is between V2 and V4. V4 is blue, that is mid clavicular line, and then V5 between V4 and V6. You will not understand here, so let me go to the next slide. Okay, this is the ECG. Okay, first let's see, this is the ECG and how it looks like. Okay, so this is 12 lead, 1 2 3 4, like AVL, I mean AVR, AVL, AVF, then 1 2 3 V1, V2, V3, V4, V5, V6. This is the 12 lead ECG. Okay, and here are 10 placements only. One is, these are four for the legs and arms, right? Two legs, two arms, and these are over the chest. Okay, how it is placed here? Look at this. Understand the lead placements. These are the basic landmarks for the 12 lead ECG. This is for the 12 lead ECG. 12 lead ECG. So they have just left those things. So this is basic landmarks, if you can see. So this is, I mean, usually in the skeleton, this is, this is the central sternum. This is the sternum. And if you look at the left side and right side, right? So this is your left side, this is your right side here, right? This is your right side, this is the left side. If you are standing like, front, this is a frontal view of your skeleton. This is the frontal view of your skeleton. So in this line, this side is left side, this side is right side. Okay, so in the left side, these three, leads are placed here. First is at mid clavicular line. What is mid clavicular line, guys? Can someone tell me mid clavicular line? What is mid clavicular line? Yes, someone? You know the anatomy of the body, no? Anatomy of the human body. Tell me, what is mid clavicular line? Yes. Someone please. It is there also. You can speak, you can write. Middle of clavicle bone. Okay. In the layman language, I don't understand what is clavicle bone. Clavicle range. I don't understand what is clavicle range. Tell me in the normal layman language. I don't understand this language. Collarbone. Okay. Shoulder bone. Okay. No, where is mid clavicular line? Tell me mid clavicular line, where it is in my body. At my left side, where it is. Middle of the collarbone. Middle of the collarbone. Where is the middle of the collarbone? Okay. Middle of the collarbone, right? Side middle or the front middle? Guys, tell me. Side middle or the central mid? Front mid. Side middle.
Center of the collarbone.
Center of the collarbone. Okay. Center of the collarbone. Okay. No. Okay, let me tell you how it usually goes. Mid clavicular, definitely clavicle, mid of the clavicle. Yes, front middle. So this is not the front middle of the body. Okay, this is front middle. If you can see, look at me. Array, this from this AI cameras now, it's very difficult to. So it is not catching. It is just focusing on my face only. It is not going now. Okay. Anyways, so if you look at this, mid clavicular line is usually not the mid of your chest. It is the mid of your left side. If you just focus on the left side, not the right side, on the left side. So this is middle of the left side, exact middle of your left side, front left side. From the back or front, wherever you see, it is middle of your left side. The body divide into right and left, and this is completely middle of your left side, completely middle of your left side. That is called mid clavicular line. So they place it here at the fifth, at the actually between fourth and fifth. Okay, so here if you look at this, these are the bones, right? One, two, three, fourth so this is four, and between four and five, this is fourth intercostal space, right? This is second intercostal space between C. So this is first intercostal space between one and two, two and three second, three and four third, fourth and five, that is fourth intercostal space, and then between 5 and 6 it is fifth intercostal space, right? So in the fifth intercostal space, this side, in the left side they place the leads. They place the leads at the left side, and the first lead will be at exact fifth intercostal space and mid clavicular, mid of your chest. Okay, mid of your chest, like when you are vertically dividing yourself, vertically dividing your left side, that is called mid clavicular line. And at the fifth intercostal space they put the V4, and then V6, then they put V6. Where they put V6? Mid axillary line. Can someone tell me what is mid axillary line? Yes, guys, come on, you all are not laymen. Tell me what is mid line, mid axillary line. Yes, guys. Yes, guys. Okay, runs in the middle of the armpit. Okay, neat and lateral region. Okay, middle of the lymph node. Technically, yes, right? You all are right. But it is when you look at the side of a human being, side of a human being. So almost middle from the side, left side. If you look at the left side, when we place that, so it is almost the middle of the left side. Middle of the left side means from the side view, not from the front view, from the side view. From the side view, middle line of the human being is called mid axillary line. There we place V6 at the same fifth intercostal space. And now at the mid of these two, there is anterior axillary line where we put or place V5, and that all is happening in fifth intercostal space. Okay, so here you can see, right arm, left arm, right leg, left leg. So these are on the legs. Either you can keep on the shoulder or keep on the arms also. You can keep on the wrist also, or the foot also. Foot also you can keep anywhere, but you can keep on the shoulders also or the thighs also. For the arm, you can keep anywhere on the thighs, on the legs, or on the arms, including shoulders. Okay. So this is right arm lead, this is left arm lead, this is right leg lead, left leg lead. Okay, this is V1, V2, okay, and then V3 in the same line. V2, usually V1 and V2 are in the third intercostal space, V3 fourth intercostal space, and V4, V5, V6 as per the instruction in the fifth intercostal space, okay. You will see here, this is 3 lead or 3 electrode ECG, left arm, right arm, left leg, right? You understand the placements? So uses 3 electrodes only, okay. I think that we can discuss in the next class, guys. Electrodes we can discuss, or we can discuss today. So here you can see lead 1, lead 2, lead 3. This shows like this only. Where did you see such leads? Can someone answer me? Where did you see the 3 electrode or 3 lead ECG, guys? Yes. Yes, guys. ICU. Yes, fantastic. In the ICU monitors, either you 3 lead ECG, you see either 3 lead ECG or 5 lead ECG. ICU monitors usually show the 3 lead ECG only. Nowadays, they new ICU monitors have 5 lead ECG also, sometimes 12 lead ECG, but majorly you will see in ICU 3 lead ECG on the monitors. Okay, 3 lead ECG, then 5 lead ECG. You will see 5 lead ECG like this. There are 5 leads. Okay, sorry, this is not 5 lead, guys. This is not 5 lead. Sorry, I think by mistaken I kept something else. Right, this is not 5 lead ECG. Okay, no problem. That we'll get in the next week. I'll replace it. I think by mistake and I kept the 12 lead ECG for 5 lead. Okay, so let's stop here for today, right? We can continue the rest in the next class. And you guys, please, I'll tell you now. Today you understood the physiology. Today you understood what is the ECG, right? And today you understood at least the types and placement of ECG links. Okay, placement of ECG leads. Okay, you understood the placement of ECG leads, right? Placement of ECG leads. So this is very, very important. Okay, this is very, very important. And here is your link. You're asking for slides, PPTs, or what? Daisy, you're asking for slides or now notes likely? No, recorded class I'll share immediately. Recorded class I'll share today only mostly. Okay. Yeah. Okay, guys. So thank you very much. Please fill the form. Okay. Yes.
Thank you, sir.
Thank you very much. Thank you, everyone. Chalo, bye-bye. But I please fill the form, everyone. That is attendance form.